Hi, my name is Dr. Shapkin. I'm a chiropractor in South Florida. We're working on somebody with an acute lower back pain. This is a Cox flexion distraction table. This is designed to help open up areas that are restricted without using excessive force, help feed the disc and open up the disc spaces. What we're doing right now is gently distracting the spine, getting to the point where the patient can tolerate further treatment.
This is mainly being used for people with herniated discs, protruded discs, people who have been told that they needed back surgeries, and obviously the results that Dr. Shapkin has seen on this is probably up in the high 80% of prevention when it comes to surgical procedures.
What we're doing right here is we're stabilizing the spine and removing the lower extremities in an effort to open up the disc, to give it nourishment, and to decompress the area.
So strictly here you're going in a flexion distraction.
This is a flexion position right now. We're going to be doing lateral flexion and circumduction soon. I want the patient to become comfortable before we go into the advanced movements.
Maybe the patient can actually keep her head down and just have her vocalize what she's feeling.
Norma, how are you feeling right now from this treatment?
Yeah, it's slightly painful, but the pain decreases.
You feel less pain as he progresses on it, as he actually stretches the soft tissue?
Yes, it does.
Okay, you can go into a little lateral flexion. And lateral flexion will actually bring the disc side to side as we're actually opening up the disc space. And on circumduction we'll be putting it through different ranges of motion, left and right, to actually restore movement back into the joint, as well as movement of the nucleus pulposus, which is the gel-like substance inside the disc, to bring it back to the center to reduce irritation and nerve root compression.
This is circumduction right now.
100% very safe procedure. There is no osseous force to cause or sustain any injuries or damage to the soft tissue structures. And the whole purpose of this is to help reduce nerve irritation and compression, particularly of the lower lumbar nerves that's exiting out the lower buttocks, down the legs, into the lower extremities that we call sciatica. Obviously, as the procedure continues, it becomes a lot easier with the patient as the soft tissue starts to become more stretched out and less hypertonic, or we can say less contraction of the muscle, reducing muscle spasming and muscle guarding. As Dr. Shapkin is doing this procedure, he can feel under his hand he's stabilizing the lower lumbar segment of the disc that's involved as he's using the table to open up the disc space to help reduce the nerve irritation in the lower back area.
Also feel a nice gentle release of the lumbar facet joints, or the zygapophyseal joints, which are some of the weight-bearing joints in the lumbar region, which take the brunt of life.
You feel a release in the lower back area as you're doing that, Doc?
Yes, I do. Increased range of motion.
So when you first start out, you notice the range of motion is much more diminished. And obviously, the patient's much more apprehensive because of the pain that she's sustaining, that she sustains. And obviously, as you continue on with the procedure, you can feel much more increased range of motion. And obviously, as the patient will get off the table, she will obviously be standing a lot straighter with a lot more mobility that she originally had.
With less muscular contracture in the erector spinae muscles as
And,
well.
and ideally, the whole purpose is to reduce pain and increase function. From another perspective with the patient's lower extremities, a lot of people who have low back pain can have pelvic leg length inequality, where the pelvic can be rotated up higher than the other. We'll go ahead and we'll get a leg length here, and you can let me know of what we see. We see
Appears to be even.
appears to be even right now. Good.
Okay. So if you come up nice and easy, Norma.